If you live in Florida, listen up because the measles has found us. Baptist Health has confirmed 2 pediatric cases here in Jacksonville. So why are doctors concerned? Because measles is one of the most contagious viruses on Earth. It's spread by respiratory droplets, which can be shed by the infected person through just talking, definitely through coughing or sneezing. It can stay airborne up to 2 hours, even after the infected person leaves. So just walking through a room with someone who has had measles can get you infected if you're unvaccinated. It can also stay alive on surfaces for 2 hours. So if you were to touch that surface and touch your eyes, nose, or mouth, you can also become infected. And just one person with measles can infect up to 18 people. To give you an idea of how contagious that is, when someone gets the flu, they typically infect 1 or 2 other people, and COVID, 2 to 5 people. So it's very contagious. Once you're exposed, it can take 7 to 14 days for your symptoms to even show up. So this makes contact tracking really difficult. And measles just starts out like a cold: cough, congestion, runny nose, some sneezing, pink eye, fever, and before you know you have measles, you're already shedding the virus 4 days before the characteristic rash shows up. The rash typically starts on the head and works its way down your body. And you're contagious from 4 days before the rash even starts to 4 days after that. And 9 out of 10 people who are unvaccinated, if exposed to measles, will get it. The measles is not just a rash, especially in young kids. It can have severe complications. On the milder end, they can have dehydration from diarrhea. They can have pneumonia needing hospitalization. But some of the more concerning complications are encephalitis, which is brain swelling, and this can lead to death. And measles can wipe the immune system for months to years, leaving you vulnerable to lots of different infections. And one of the long-term risks of having measles, though it's rare, it's absolutely devastating, is something that's called subacute sclerosing panencephalitis. And this is swelling of the brain, and it is fatal. And it typically doesn't show up until years after someone has had the measles. The good news in all this is that it's completely preventable. We have the MMR vaccine, which is super safe and highly effective. Just 1 dose of the MMR vaccine is 93% effective about 2 weeks after that first dose. And once you get your second dose, it jumps up to 97%. We're only 3 weeks into 2026, and we've already had 416 confirmed cases of measles. So why are doctors worried? With everything else that's going on in the world, the last thing we need is another outbreak. So who should get a measles vaccine? If you were born before 1957, you don't really have to worry about it that much. But if you want to get one, discuss it with your doctor. If you were born after 1957, check your shot record and see if an MMR is on there. For pediatric patients, we typically give that first dose between 12 and 15 months, with a booster dose between 4 and 6 years old. Now, pediatricians will typically give an early dose of MMR if you are traveling to another country that has measles or there's an outbreak in the area, but your child still needs the other doses at 12 to 15 months and 4 to 6 years. And here's why. So when a baby is born, they have antibodies from mama until around 9 months old. So when we give that vaccination before that time or before the regular scheduled intervals, the child can have not as a robust response to the vaccine, meaning that the protection from that immunization is going to wear off a little bit over time. And so that's why we have to boost again at 12 months. And remember that 90% or more of the population has to be vaccinated in order to slow down or stop the spread of measles. And Florida has a huge influx of international travelers, so we're at an increased risk. And just for a little history lesson, in the year 2000, measles was considered eliminated in the United States. So it's the decline of vaccination rates that is opening us up to vulnerability of getting these infectious diseases. And if you are hesitant to vaccinate your child, please understand that we know as doctors that it's scary, and all the misinformation out there is very scary. I'm a mother myself. I have 4 children and they are all fully vaccinated, but I want you to bring those concerns to your doctor. Drop them down in the comments below to me and let me try to take the time to answer your concerns, answer your questions so that you feel more comfortable making these decisions. I'm Dr. Key. If you found this video helpful, please be sure to share it with others.